Hello, my name is Bobby Schneller, and I'm the program director at our Rapid City Hospital Family Medicine Residency Program. I have been in that role since 2017. Full disclosure, I'm a graduate of the program. I attended here from 2006 to 2009, and at that time there weren't a lot of family medicine jobs in Rapid City, so I moved to northern Minnesota, a little town called International Falls, and I practiced full spectrum family medicine up there. I delivered babies, I had a busy outpatient practice, I was a hospitalist at 1 week out of every 6, and I was the medical director for the local nursing home. And it was a great practice. It was medicine without a net. We were about 2 hours from the nearest large hospital. However, we had a couple surprise kiddos while we were up there, and we were very homesick for Rapid City. And when the opportunity came up for me to be a faculty, I jumped at that chance, and I have been back here since then. I'm going to tell you a little bit about our program today. Rapid City is a great place to live and work. I think anybody who lives here is, the location is the main driver for why we are here. There are a number of national and state parks close by. Everyone knows about Mount Rushmore, but we also have a number of other parks, Devil's Tower, Jewel Cave, Wind Cave, Custer State Park, and the Badlands, within about an hour of the hospital, and each one of them has a different flavor. The key is you can be lost in the woods within about 20 minutes of leaving the hospital, and it's a great thing. Fun story for me, I have actually stood legally on George Washington's head. A number of years ago in a past life, I worked for the Rapid City Convention and Visitors Bureau, and we had an organized hike to the top. If you ever get the chance to do it legally again, I highly recommend it. It is breathtaking. There are a lot of things to do outdoors in Rapid City. We have year-round hiking and biking. There are hiking trails right in Rapid City proper. Mickelson Trail runs north to south in the Black Hills, and actually one of our faculty members just completed the Mickelson Trail this weekend, which was a lot of fun for him and his family. There's rock climbing, boating and fishing, camping and hunting. Adult recreation leagues, our residents routinely participate in volleyball. There's golfing that happens here regularly, and a number of our kids participate in hockey. In addition, there's a lot to do in Rapid City and the surrounding areas. There's great restaurants and shopping. We have a vibrant downtown. Deadwood is an Old West community that's about 45 minutes from Rapid City. It's got gaming. It's got a lot of events, restaurants, bars. It tends to be a really fun place to go. The Monument is a new construction that has our name on it. It is a concert and event venue, so we bring in a lot of big name groups. We have the rodeo and stock show every January. Lakota Nations Invitational for different sporting events. There's a big basketball tournament that happens every December. We have the Rapid City Rush Hockey League, which is, we have suites that you can auction off or you can purchase from the organization. That is a lot of fun for your family or for a group to go do. The Journey Museum here in town has a lot to do with our pioneer culture, our Native American history, our geologic history, and just information about our area in general. And every August we have the Sturgis Motorcycle Rally, the area has about 750,000 people in the state of South Dakota. We routinely double that population for 10 days every August, where motorcyclists from all around the world come to our area. As far as physicians go, there are a lot of opportunities to be in the ER, to work with ortho, to work with general surgery, and get some really good experience. Some of our residents want to stay far away from that, and so they go to OB or pediatric rotations, but it is an amazing thing to see. Monument Health has grown a lot over the last 30 or 40 years, but really over the last 10 we've seen some big improvements. We have 40 healthcare facilities throughout the Black Hills. We are a tertiary care referral center serving 5 states. So if you put a pin in Rapid City and draw a circle around us 250 miles, we are the largest facility. We have the largest emergency department in 2 states. We routinely have 55 to 60,000 visits a year in our ER. And we are a member of the Mayo Clinic Care Network, and that's a pretty exclusive club to be in, and it allows us to have some educational opportunities. We are able to receive e-consults through the Mayo facilities and different specialties that we may not have here in Rapid City. This is just a picture of our main hospital. You can't see the tower in the back, but we do have a 10-story tower in addition to this. Our emergency room's on the right, and our Heart and Vascular Institute is on the left in this photo. Monument Health is growing. We have a new specialty hospital that will be opening fall of 2023. That is the target date at this point. It is a rehabilitation and critical care hospital of the Black Hills. And when this opens, it will be a big bonus for our community, for our patients. Currently, the closest LTAC facility is about 200 miles away. And to have this in our community, we'll have 18 LTAC beds and 36 rehabilitation beds. That will be amazing. In addition, we are completing the expansion of our Cancer Care Institute. We doubled the size of that. We doubled the number of oncologists we have, and they are just completing. They're just completing that building as we speak. We are in the process of expanding our women's and children's facility, which is on the west side of our hospital, increasing our NICU size, and getting a pediatric intensive care unit up and running. And then in Spearfish, which is a community about 40 miles north of Rapid City, we are expanding the hospital significantly. There's been a lot of growth in the Northern Hills, and there are a lot of opportunities for our residents to rotate up there, as well as some job opportunities. So now we're going to talk a little bit about the family medicine residency program. We have a number of things that we're very proud of that we do here. Our outpatient clinic is one of those things. We anticipate that our residents will get about 1,800 outpatient visits per resident during residency. And with that, you will see your own patients. So the ACGME requires that by the time you graduate, you're seeing about 40% of patients. The 40% of the patients you see will be your patients. When we started looking at those numbers, we realized that we're averaging somewhere between 60 and 65% for most of our residents. And our goal is to increase that so that you're seeing your patients more frequently. It increases resident satisfaction, it increases patient satisfaction, and really improves patient care. All of our residents participate in a clinic efficiency curriculum, which is led by a couple of our faculty. Basically, several times throughout your residency, a faculty member will sit and observe you and your nurse and how you guys work, and what things can you do better to improve patient flow, get you out on time, get your notes done. That's been very popular with our residents. We also have the largest HIV clinic in the state of South Dakota. That is run by one of our infectious disease physicians. We have a pharmacist in-house who participates in that clinic. One of our faculty is specially trained in HIV management. We'll have pharmacy residents, and we have nursing staff that will help out with those patients as well. Currently, we have about 90 charts. We have had a little bit of an outbreak recently, so we've increased our patient numbers a bit. But when you leave here, our goal is that you will be able to integrate HIV care seamlessly into your clinic, if you so choose. Our obstetric experience is robust here. Most of our residents will get 60 to 80 deliveries and 40 to 80 C-section assists while they're here. All residents will deliver at least 10 of their own patients. We call those continuity deliveries. You're there from the pregnancy test through the well-child check, and you'll do those deliveries with your FM faculty. We all participate in obstetrics here. There are opportunities to do primary C-section training. You don't have to do that, but I will tell you a number of our residents are out in critical access hospitals throughout the Midwest and Intermountain West, providing primary care surgical obstetrics. Our inpatient medicine service is very, very busy, and we are frequently managing university-level pathology. Our patients here tend to be maybe a little more sick than in other areas. Part of that is that there's limited access to care in the outlying communities, particularly on our Native American reservations. Unfortunately, with that, you get some of those complications of poorly managed chronic diseases over a lifetime: diabetes, end-stage liver disease, end-stage renal disease, heart disease. And with that, we want our residents to have a high level of autonomy on our inpatient service. We're going to let you make your own plan, and we're going to sit down and talk through that plan every day. There's faculty and senior residents available 24/7, but we want you working through your patients' problems and trying to find solutions for them from the very first day you start residency. Our residents will manage somewhere between 5 and 10 inpatients on average during their first year. We start out on the lower end and move up as we need to. But we do have a cap on our service, so if it gets overwhelming, we have resources we can call in order to make sure our patients get good care. Quality improvement is something we've worked on since the beginning of the pandemic. We made some changes. All of our residents will have dedicated time to work on resident-selected QI projects at FMR throughout their residency experience. So we'll have first years, second years, and third years assigned to it on different months. Our current projects, and these are all resident selected, are diabetic population management, lead and hemoglobin screenings for our toddlers, hepatitis C screenings for adults, and fluoride application for our pediatric patients. There are some other patient safety things we're looking at and some things in the hospital that we are in the process of working on, and that's largely resident-led with one of our faculty members, Dr. Callahan. There is an opportunity for lean belt training through the organization. Quality improvement will follow you wherever you go in your career, and having the tools and the skills to be able to participate in that is really critical, and that lean belt training is something that is helpful to develop those skills. We are unopposed, which is why I'm guessing many of you are with us today. It means we're the only residency program in our hospital system. So you're not fighting obstetric residents for deliveries, and you're not fighting surgical residents for procedures and internal medicine residents for admissions. We tend to have a lot of resources at our fingertips. Our residents know a number of the specialists by their first names, have their numbers, are very comfortable just talking to them in the doctor's lounge about questions they might have regarding their patients. We also, just kind of some fun stuff, we got a new resident lounge at the hospital that opened July 2023. It's close to patient care, it's close to our call rooms and to the doctor's lounge, where that's important because that's where all of the food is. The family medicine residency clinic also has 2 work areas and lounges dedicated for residents to just have some privacy, have a place to quietly do their work. We have 100% ABFM board pass rate and take rate, and we've been that way for several years. Part of that is that we have residents who have access to the Challenger program from the first day they start here, and our third years all receive the AAFP Family Medicine Self-Study Package. That's about a $900 program. It's online, and it's done by the people who write the questions for the boards, and so that has been very, very useful in keeping our residents up to date. We also reimburse our residents for their first attempts on both Step 3 and the ABFM boards, so it benefits you to take it while you're here in residency. We also have what's called the SonoSim POCUS training available to our second and third year residents, and if you complete those modules, you receive CME, and you can be credentialed eventually in your real job when you leave residency to do POCUS, so that's fun for our residents as well. We are expanding our program to an 888 program, which means we'll be increasing each class by 2 gradually over the next 3 or 4 years. We are planning to do some building updates and expansion through about 2025. We're expanding our faculty roster. We actually have a new faculty member joining us shortly, and we have some interviews for an additional faculty member. And then we'll be increasing our clinical and administrative staff accordingly so that we continue to have all the resources that our residents need. Well-being is a really important topic. I think in past years it was maybe ignored by training facilities, by sponsoring institutions, and by the ACGME, but that has changed significantly over the last 10 or 15 years. We have a wellness committee that has faculty, resident, and staff members, and they come up with a lot of ideas. I think I mentioned the volleyball team earlier. They're doing pretty well this year from what I hear. We have annual resident retreats for each class, so that we kick in a little bit of money and a little bit of time off, and just allow residents to have time with their classmates to reconnect. We have a number of fitness challenges that happen throughout the year. Currently, we are finishing up our Lazy Man Triathlon, which means you do a full Ironman triathlon, but you have 4 or 5 weeks to do it. There's a Hiking in the Black Hills challenge. It's a bingo type situation where as you hit the different trails around the Black Hills, you fill in your bingo card. And we have little prizes for people who complete those things. Fantasy football is happening right now. I am doing terribly. I think I'm in last place except for the people who forgot to make their picks, but it's a little bit of a rivalry, especially down amongst the faculty. And we have cooking challenges from time to time. So the entire staff will have a soup cook-off, or we'll do holiday cookies or different things. And that's for our less sports-minded residents and faculty. When you're in the residency program, you will eat well. We have a generous meal allowance at the hospital cafeteria and the coffee shops at our hospital. We have 2 coffee shops with Starbucks coffee. Lunch is provided at all required conferences and meetings. You have access to the physician's lounge and with grab-and-go snacks there. We also have grab-and-go snacks that are healthy available at our clinic for all residents. For some of your behavioral health and mental health resources, we have Employee Assistance Program, which is 24/7 access to those services. And all residents have the opportunity to take the Maslow burnout surveys. It just kind of gives you a snapshot in time of how you're doing with your wellness and can help you identify if you maybe need to take some steps to improve that. So healthcare disparities are something that we have started looking at very closely. Our clinic is in an underserved area of Rapid City. Most of our state, frankly, is underserved, and so we have a lot of opportunities to help our patients overcome some of those socioeconomic challenges. About 5 years ago, we opened up a food pantry that is exclusively for the patients of the FMR. They can come once a month. We tend to keep very healthy foods there, foods that will not make their chronic conditions worse, and it has been important for our families and for our residents to learn about some of the struggles those families are facing. We give away about 2,000 pounds of food per month out of our food pantry. We also have a community closet. It was started years ago by a resident who identified that one of her patients did not have all the services we might want a new mom to have. So she went out and bought clothes and some supplies for that mom. That mom brought back the clothes when the child outgrew them and said give them to somebody else, and it sort of snowballed from there. That has been very helpful for a number of our community members who are just lacking resources. We also have some training around the subject of poverty and just trying to understand what our patients face every day. We closed our clinic last year and had an afternoon where we did a poverty escape room where you're given so many resources and so many tasks to complete. And, honestly, we struggled to complete those tasks. It was eye-opening, the struggles that our patients face every day. All of our residents during their community medicine rotation will do a training called Poverty 101. Again, they can learn about the resources in the area and the challenges our patients are facing. We occasionally have the opportunity to send some of our staff members and some of our residents on the Lakota Lands tour. We have several reservations in western South Dakota, and the Lakota people have a very rich and vibrant culture. And it's important to know about what that culture is and how the culture is different from what we would typically think in other areas. We take care of a number of Lakota patients, and so this has been, it's really an eye-opening and fun experience. We are also in the process of starting a patient advisory council. We want to look at the residency from the eyes of our patients. How do they see it? What things could we be doing better? And so really they're going to give us some ideas. Residents will participate in this council, and we will have permanent members. They are our associate chief residents or permanent members of the council. All right, I'm going to try and answer some frequently asked questions. Hopefully you have those written next to you right now, and we'll see if I can check some of them off. When and how much will I be working? So in your first year, you do not take overnight shifts here at Rapid City Hospital. It's our second and third years who do that, and we have a night float system, and it's a little bit complicated how it all runs together, but we follow our duty hour rules very, very carefully. You can expect when you're on our inpatient service and when you're on night float to get really close to that 80-hour-a-week work limit. We don't go over it. We structure it so that you have adequate time off, but those are real busy months. In most of your other rotations, you can expect to work about 50 to 60 hours a week, and there are some that we know that are much shorter than that. Will you actually earn a paycheck? Yes. We offer a salary that's competitive with all the surrounding residency programs. We also offer an executive level benefits package that includes professional liability insurance, including tail coverage, paid time off, CME time and funds, health and dental insurance, life insurance. We provide a moving allowance, and so as soon as we know who's coming here, we tend to get those checks out very, very quickly. Dues for professional memberships, and convenient parking at no charge. I can pretty much see my car from where I'm at right now, and at the hospital we're in covered parking, which is really nice. What kind of procedures can you expect here in Rapid City? I mentioned the primary C-sections. Again, those are, if you want to do those, you can. OB ultrasound, we do vasectomies in this clinic, casting, lots and lots of vaginal deliveries, skin excisions and biopsies, joint and trigger point injections, IUD placement and removal, and Nexplanon placement and removal. We get our residents that training pretty much as soon as they hit the door in July so that they can do that implantable contraception. And circumcisions. So people want to know about residency tracks, and they want to know how can I customize my education. All residents over the course of 3 years will have 6 months of electives on their schedules. And we went through and we have created recommendations. If you have a certain type of practice in mind, what rotations would be appropriate to kind of tailor your education. And so our special areas of interest that we have developed tracks for are hospitalist medicine, rural medicine, ambulatory medicine, sports medicine, and obstetrics. You will select your rotations in concert with a faculty advisor, and then they all go to me, to the program director, for approval. Now, you will have to go out of town for a couple of rotational experiences. In your first year of residency, you will go to Minneapolis for a month to do an inpatient pediatrics rotation. We just don't have a robust enough inpatient experience yet to make that work in Rapid City for all of our residents, although we're working on it. We send you to Minneapolis. You have a safe, secure apartment in Edina. It's across the street from the mall, lots of good shopping there, and we do provide a stipend for when you go out of town. In your second year, you go back to Minneapolis Children's, same apartment, same area, to do an ER rotation in pediatrics. And again, we don't have that experience here in Rapid City, so it's just a good idea to go out there. People love this rotation. It's shift work, and it tends to be in the more temperate months in Minneapolis, so you can go out and do some of the really fun things the city has to offer. And then in your second year, you'll also do a rural rotation that has to be in South Dakota. It can't be in Rapid City or Sioux Falls, but pretty much anywhere else is fair game. Most of our residents, probably 80 to 90%, will choose to stay in the Monument Health System and go to one of our critical access hospitals out in the Black Hills, and then sleep in their own beds at night. They commute. But every once in a while we get a resident who wants to go out to Mobridge or Burke or Aberdeen and really immerse themselves in a community, spend time on the sidelines for the football games, and really just have an immersive experience in their community. And again, anytime you go out of town, whether you choose it or it's required, we do provide a stipend. How stable are we? We have a fully staffed faculty group that includes 7 physicians, a full-time pharmacist who attends inpatient rounds every day, staffs our HIV clinic, and is available for outpatient consultation, and we have a licensed social worker who sees patients in our clinic. We have no citations from the ACGME, and we have not had them in a very, very long time, and our goal is to keep it that way. And we are well funded by our sponsoring institution. And finally, can I moonlight? Yes, you can moonlight in your third year. You have to be in good standing, obviously, with the program and have an approved wellness plan. We know that adding anything else to the residency experience can be stressful, so we want to make sure that you have a good off-ramp if there is any kind of issue. So I'm going to end the PowerPoint now and just kind of open the floor to any questions you might have, and then we'll get going with interviews.